Good morning, everyone. My name is Christy Mathis, and I'm the Director of Media Relations for the province, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Honourable Michelle Thompson, who's our Minister of Health and Wellness, who's going to kick us off with a few words this morning.
Good morning, everyone. Thank you for being here today. I'm humbled that the Premier has trusted me, and I'm very excited to get started in my role. I've had personal healthcare experience for 30 years, both as a registered nurse and most recently as a long-term care administrator. I can tell you that our healthcare workers in this province are second to none, but our system is broken. Change is hard, but it is absolutely needed. The Premier has made our vision for healthcare very clear, and I'm pleased today to be here as he shares some first steps. Thank you. Go ahead, Premier.
Thank you, Minister. Thank you, Minister. Good morning, everyone. First, I want to speak directly to those who have been working tirelessly these past months to protect Nova Scotians from COVID-19, including nurses, doctors, administrators, continuing care assistants, working long-term care facilities and otherwise, staff at the Health Authority and the Department of Health and Wellness. Thank you. I know the tremendous toll that the pandemic has taken on you and on your families. Your community, your government recognizes and appreciates your commitment and dedication to keeping us safe. Everything you hear from our government, every change that we make is all designed with one goal: to support you, to work with you and improve access to healthcare for Nova Scotians. You have a partner in our government, and we know we have partners in you. So my message to you is that change is coming. Help is on the way. We heard Nova Scotians loud and clear when they told us healthcare was their top priority. The next thing I want to do is acknowledge that improving access to healthcare means working together, but it also does mean transformational change. This includes a change in the leadership and governance of healthcare in Nova Scotia. And I want to thank the former CEO of the Nova Scotia Health Authority, Dr. Brendan Carr, and the former board members for their service and commitment to Nova Scotia. I wish them nothing but success in the future, and I thank them for their service to Nova Scotians. But that brings us to this moment. I'm proud to be here today with the new leadership team for the health system in Nova Scotia. Karen Oldfield. Karen served as the CEO of the Port Authority for 17 years. She has experience leading a large, complex organization and its people through change. Karen will serve as the interim CEO of the Nova Scotia Health Authority. Thank you, Karen. Janet Davidson. Janet, the former chair of the Nova Scotia Health Authority Board, has been appointed to be the administrator of the Nova Scotia Health Authority. Janet has a long and respected career in healthcare strategy, management, and governance. She served as the interim CEO of the Health Authority in 2019 and has held various leadership roles in healthcare organizations. Her knowledge and experience will be invaluable to Nova Scotians, and thank you, Janet. Janine Lagasse, the former Associate Deputy Minister of Health, a lawyer, a long-term civil servant, will be the new Deputy Minister of Health and Wellness. Thank you, Janine. And Dr. Kevin Orrell. Kevin will be the CEO of a newly created office to focus on recruiting the healthcare professionals the system so desperately needs. Thank you, Kevin. I can't tell you how excited I am about this leadership team. I am very excited. And one of the first things this new team will do is join me on, as we work our way around the province, speaking to frontline healthcare professionals and listening to them and learning from them. We'll work our way around the province during September 20th to the 23rd. We'll meet with the people that are providing care in this province on the front lines from Yarmouth to Cape Breton. No one knows the issues better than the people who work bedside and delivering care every single day. Nobody knows the issues better than them. We want to hear what they have to say. We want to listen to them. We want to work with them on solutions. So this leadership team understands their mandate. That is a mandate to listen to learn and to take quick action on things that can be done to improve healthcare. They will be empowered to make decisions on things that will make an immediate difference. And I'm very excited for them to see the results of their work. And before I close, I want to touch on the new Office of Healthcare Professionals Recruitment. This standalone office will report to Minister Thompson and will be judged, as I will be, on its ability to attract and keep healthcare professionals to Nova Scotia. I can think of no better person to lead this than one of the most respected physicians in the province. So thank you, Kevin, for that. Next, I'm going to turn it over to Karen to say a few words about how this new management team will work with frontline healthcare workers and system leaders to drive the changes that Nova Scotians have asked us to deliver. Karen.
Well, thank you, Premier. You've given us a big job. It's a very important job, and Premier and Minister, we're ready. We're ready to work with frontline healthcare staff and leadership inside government and at NSHA to get the health system functioning the way it should. I'm very much looking forward to meeting the team at the Health Authority and then joining our new Premier and Minister Thompson while we work our way around the province. We know there are barriers, and it's our job, the job of this team, to remove them. The care providers and support staff in the system, well, they know what needs to be done. You know what needs to be done. But there are so many hurdles and barriers and red tape and bureaucracy in the way of action and change. Together, we will make room for change that will lead to better health care for Nova Scotians. That sounds pretty simple. And I know that it is anything but. Healthcare is complex. It's a gargantuan task. We'll start by streamlining decision-making and moving immediately on things that can be done quickly. This team is all in. We are all in to work to deliver the Premier's vision for healthcare in Nova Scotia. Thank you for your trust, Premier. Minister, over to you, Dr. Orrell.
Thank you. Good morning. First of all, I'd like to thank Premier Houston for the opportunity that he presents today. I'm very excited to be working with my new colleagues as well. I think the team that is in place will be capable of doing some very, very important things in our province. We recognize that people are the strength of our healthcare system, and we have dedicated professionals over many sectors providing care in Nova Scotia, and we've witnessed this during the pandemic. It's been a challenge to attract new professionals. For the 31 years that I've been an orthopedic surgeon, as part of the healthcare system, I have witnessed gradual changes. And this has resulted in stress that has led us to the situation that we face today. We are at very low capacity in terms of the professionals we need in this province to deliver care to Nova Scotians. Tens of thousands of people are looking for family doctors. There's a vacancy rate in the health authorities of 20% for nurses, and CCAs are in short supply, challenging our long-term care homes. We are at a critical stage, and recruitment efforts have been going on for years, but we need to step it up. The new Office of Healthcare Professionals Recruitment will be laser-focused on bringing doctors, nurses, continuing care assistants, paramedics, and other professionals to the province. It will not be easy. Demand for these professions is high across the country and, in fact, throughout the world. And Nova Scotia will be competing with other provinces for the same Canadian graduates and foreign-trained professionals. The new office will not only recruit professionals, but will also eliminate the barriers that exist to bringing them to the province. For example, I know of a new doctor who wanted to return to Nova Scotia after the completion of her specialty training in Western Canada. This was to fill a vacancy that existed for 8 years. After she applied for the job, it took months of very awkward negotiation before she was offered the job. But luckily, she was dedicated to coming back to the province. I am proud to say that this committed young rehabilitation specialist is my daughter. She is one of the many Nova Scotian-born physicians who wish to return to the province to work. We need to make Nova Scotia a welcoming place for professionals with a streamlined system that will bring them here. Nova Scotia has much to offer healthcare professionals who are looking for a rewarding opportunity to practice. The new Office of Healthcare Professionals Recruitment will help to ensure that this occurs. Thank you.
Thank you, Dr. Orrell. We'll now take questions from reporters both in the room and on the phone. We'll begin in the room.
Premier, you talk about transformational change. I guess we're seeing it here. The plan to dissolve the board, how does that involve maybe streamlining, or what was your decision there?
Everything is focused on making sure people can access healthcare. So the end goal is always, I've said before that I will consider myself successful, our government successful, when I'm walking down a street somewhere and somebody stops me and says, I was waiting for a doctor for 5 years and now I have one. Or I was waiting for a surgery and now I have one. So we're always focused on that. So we back up from that and we say, how do we get there? And the very first step in getting there is empowering a team of people to get it done and to move it forward. And that type of story that Kevin just shared, very personal. I feel the emotion in that. I hear those stories all over the province. And now we need to say, well, why is that happening? How can we reduce the hurdles? So what I need to do, what I felt the urgency to do was get a team of people in place and give them the tools that they need to get the job done. And this is a team of people that I trust, I have great faith in, and there's no hurdles in their way. And that's where we needed to start, so that's where we're starting.
Was the board of directors a hurdle in a way then? I guess I'm just wondering why you're dissolving that.
We just need to keep it laser focused. We'll build out the structure, we'll make the changes to the structure that are necessary, but we just needed to start with the clean slate that was just had the ability to be laser focused on getting to where we need to get.
Is there a cost associated with getting rid of Dr. Carr and the board of directors?
Yeah, I think in this province, it's look. I thank Dr. Carr. I thank the board members for their service. They're all people who care about this province and want the best for this province. And but I was elected to make changes in healthcare, so we have to make those changes. But in making those changes, of course, we're respectful of people on a personal level and a professional level. There are contracts in place. Of course, we honor those contracts. The main thing is that we put the team in place that can execute on the vision that Nova Scotians asked me to execute on. So very respectful of the service that's been provided to Nova Scotia. They all want good things for Nova Scotia, for sure. And of course, we respect the contracts that are in place.
Is there a dollar figure associated with that you can share?
We can get you any of those numbers. Yeah.
You referred to Ms. Oldfield as interim CEO. Is there a plan for a permanent position?
Well, today we just wanted to get started today. So put people in the right place to get started, and we'll see what the future brings. But there's a very clear mandate for this team. They understand that mandate and they accept that mandate.
Ms. Oldfield, I wonder if you can give us an example of a hurdle you talked about that you can knock down immediately to get something done immediately. You mentioned both in the same breath. I wonder what you're thinking.
I think, from my own perspective, we hear a lot of stories, and I certainly hear many stories, as I have a number of people in my family who are members of the healthcare profession. But rather than share that, I think the first step is to listen to the frontline workers and be able to share their stories instead of stories that I'm hearing secondhand. So I really want to hear it firsthand, and hear it from them, along with the solutions that a lot of our frontline workers have in their own minds and yet don't have an opportunity to bring forward. So I think the first step is to listen. And I do look forward to meeting the members of the team at the Health Authority to hear their problems and their solutions. So I'm not going to get into speculation at this point. I'd rather hear it from the folks at the coalface.
Dr. Orly, you referred to your daughter's situation, but kind of vaguely. Can you put some concrete information behind what this negotiation was about? Was it pay, or are there other issues involved in that?
It had very little to do with remuneration. It was more about the red tape of actually applying and being put through a process of interviews and being given timelines for response that were not met. All of this taking place at a time when she was receiving offers to stay in the academic center where she trained or other jobs throughout the country. So had she not been a Nova Scotian committed to return to where she was raised, to a community where uncles and cousins are involved with the healthcare system, I think she could have easily been distracted to go somewhere else. And it's that kind of time frame that we talk about between the expression of interest and the acceptance of a job that we want to diminish so that we don't lose people to other jurisdictions that are prepared to act quicker.
Dr. I'll ask you sort of the same question. What do you think can be done quickly in terms of recruitment that will make a difference? It hasn't been done. And do you have any idea why it wouldn't have been done before? Because, sorry, but you're not the first person to come to the plate on this.
Exactly. This has been, I've witnessed this throughout my entire 31 years practicing surgery in the province. So yes, it's most certainly not a new problem. I think one of the things we have to eliminate is this conception that we only need a certain number of people. There's only a certain quota for people in different communities that are going to fulfill the complement of people they need in that hospital system, in those smaller communities, in the larger communities. We need the number of people that is necessary to provide care, and that should be our quota. Not we have need for 2 of the doctors in this specialty or 5 doctors in this specialty. And I think by eliminating the process of evaluating what impact they will make to the local system, we can eliminate a great deal of the time frame that's been cumbersome.
How many,
Just if I could on that, I think there's a difference in the mindset. And to Kevin's point, the mindset of our government is let's get what we need to deliver care to Nova Scotians, not just what does the budget number that we predetermined in a different room allow us to do. And I think you're going to. I'm hopeful that you're going to see a change in our ability to recruit. Obviously, starting with Dr. Orrell leading the charge, you can feel his passion for it. But with a general message that the government of Nova Scotia is serious about investing in healthcare, that the government of Nova Scotia is serious about respecting healthcare professionals and working with healthcare professionals. I think when you combine those things, it sends a message that will help with not only recruitment, but certainly retention, because if you can't keep people, you can't recruit people. So again, I just reiterate my message to healthcare workers that help is on the way, and we are focused on it.
And most certainly, we don't want to overshadow the need for other professionals like nurses, like CCAs, like paramedics, with the doctor discussion, because they are absolutely critical to this province.
how many people on the board of directors for the NSHA have been dismissed?
The entirety of the board.
Do you know how many individuals that is?
Do you have the number, Janet?
On a different note, Premier, there's a lot of criticism today about your decision to appoint Pat Dunn as the Minister of African Nova Scotian Affairs. Some people are calling the move tone deaf. They're wondering if you've looked at other options. How do you respond to that?
Yeah, look, I understand the emotions around it. Our democracy works best when people elect people to the legislature, and that those elected people form a cabinet and are held accountable by the people. So we have a cabinet from our elected caucus. We elected 31 great MLAs. We ran the most diverse slate of candidates we ever had. We had a lot of diversity in our candidates, and I thought they were great community leaders, and I was expecting that some of them would get elected, and the people in those constituencies this time around chose differently. That's the will of the people. But my commitment to the community as Premier, the buck always stops with me, and the community will be heard, will be respected. We will work with them. Our minister will listen to them, respect them, and work with them. So, you know, we're optimistic. I understand the emotions of it, but that shouldn't be interpreted as not being concerned about listening to the community.
Premier, when it comes to mental health and addictions, you stated in one of your solutions that you were going to create a standalone department of addictions and mental health with significant resources. That mandate was made clear in your campaign. We maybe thought that would be, you know, brought to fruition today. Is that still the plan, or if it isn't, why not? And why it was a solid staple of your campaign? Yeah,
the plan was always to have somebody at the highest level of government that is accountable to people and responsible for making sure that Nova Scotians can access the addictions and mental health supports that they need. So somebody at the cabinet table. We've done that with Minister Comer. He will be an excellent minister. When we looked at the initial review through the transition team, the office that had been established, we think can be very effective. So we're not into change for the sake of change. We're not into any of that stuff. We're into results for Nova Scotians. So
standalone department at this point, or is that something you're to look at?
So the office, I think the office can meet the office in combination with having a minister responsible for that office. I think will be very effective in making sure that Nova Scotians can access care, and Minister Comer feels responsible. And
it's not feasible. You ran hard on mental health and talking about creating a standalone department. That was a major part of your platform. This feels like a promise broken already.
No, I don't think so. I didn't use the word not feasible either. What I said was that through the transition, we looked at what's there. There is an office. It's relatively new. There's some great people working in that office, and I believe, based on what I know today, that office can get the job done. But my commitment was very strong to Nova Scotians that there will be somebody at the cabinet table that is completely focused on addictions and mental health. And there is somebody at the cabinet table that is completely focused on addictions and mental health. Minister Comer will work in conjunction with the office, and I believe they'll get good results for Nova Scotians. If they can't, we'll make it. We'll continue to focus on that. But as we sit here today, I'm very, very confident that results will come from that.
Given that, how soon can we see psychiatrists, psychologists, and counselors receive billing codes for MSI to treat all Nova Scotians? How soon can we get those resources and that plan in place to help?
I feel the urgency. Cabinet was sworn in yesterday. I became Premier of the province less than 24 hours ago. We've got a cabinet in place that understands what their goals are and is focused on that. So we've been very clear that we want to mobilize the resources of the province for the benefit of Nova Scotians. That means mobilizing those that are qualified to provide care to Nova Scotians but don't happen to work for the Nova Scotia Health Authority, whether they be psychiatrists, psychologists, counselors, nurses with additional training, social workers. There's a lot of people that are qualified. And it is our goal to open up the billing codes to them. We don't want to be too. There's negotiations to be done. I don't want to minimize the work that's going to require to get there, but I do want to stress that we are focused on making that happen. So we'll make it happen.
I'm going to head to the phones for a moment. I'll come back to the room if we have time. Starting with CBC's Mike Gorman.
Thank you. Premier, you and Minister Thompson obviously had issues with the way the Health Department and Health Authority were being run. But if that is the case, why keep Dr. Orrell involved at such a high level, given that as deputy, he would have been intimately involved in running the system? And why keep Ms. Davidson, given that she was chair of the board that you just fired?
Yeah, I think, look, I want to thank everyone, the board and Dr. Carr, and you know, we've made some changes, but I respect and I thank the people for their commitment to Nova Scotia, those that were impacted by it. So the reality is that healthcare, the delivery of healthcare in this province is not up to the standard that Nova Scotians are expecting. That's just the reality. Too many people don't have access to a family doctor. The surgery wait times are too long. We know the issues. So it's Nova Scotians that spoke very loud and very clearly that said, do better. So we're going to do better. And the first step to doing better is putting people that share your vision, that share your passion and your commitment to fixing the healthcare system in roles where they have the opportunity to be successful. I'm very confident that Dr. Orrell will be successful as a respected physician, as a respected healthcare provider in recruiting healthcare providers to this province. I believe he can be very successful in that. I'm incredibly impressed by Janet's commitment to healthcare and commitment to this province. So for me, this is about sending the message that the focus that I had on healthcare during the campaign is even stronger right now, and we're starting right away in day one of putting a team of people together and giving them the ability to be successful. That's what we've done today, and I'm very, very confident in this team, and I'm very confident in Minister Thompson to make it happen too.
Go ahead with another question, Mike.
Yeah, one more, thanks. Premier, by extension, when you talk about the message that you're trying to send frontline workers, obviously this is coming at the end of a very difficult year and a half for many of them. So now they're going to be exposed to some upheaval at the upper levels of management. What message does it send to them that you're, hello? What message does it send to healthcare workers that your interim CEO has no healthcare experience?
It sends the message that we're coming into this with one goal, and that's the goal to listen to them and to respect them and to work with them. So we're not coming into it with our own agenda of telling them how to deliver healthcare. We're coming into them with the desire to listen to them and work with them. That's the message, and I think that message is being very well received. People are hopeful in this province right now, and I share that optimism, and I share their commitment to making sure that people can access healthcare. And I know everyone with me here today shares that optimism as well.
A reminder for folks on the media line, please make sure your phone is on mute when you're not speaking. We'll move on to Frank Campbell with the Chronicle Herald.
Hi, Premier. You say that you're not into change for the sake of change, but today's announcement smacks of a little bit of the old days when a change of government would mean highway department workers and others would be immediately replaced. Did you have a lack of confidence in Brendan Carr and others to do the job that you want done in healthcare?
No, and it's not. This is. I think if you think back to the previous question, it was just why did I keep a senior person in healthcare, right? So this is not change for the sake of change. This is just totally streamlining the management team so that they can focus and that they can focus on working with healthcare professionals. And I think sometimes it's just you have to hit reset. And I think it's time to hit reset at the Nova Scotia Health Authority. And I thank Dr. Carr. I have utmost respect for Dr. Carr. I have utmost respect for the board members, many of whom I know personally. But it's time to refocus the efforts. And I think when we've seen the state of healthcare in this province, I think people, many people I'm hearing from that are working in healthcare, are energized by the change. So this is only about improving healthcare. This is all it's about.
Frank, do you have another question?
Yeah, one more. This would be for the Premier or for Dr. Orrell. You two had a bit of a back and forth through the media in February about comments Dr. Orrell made concerning Northwood. How would you describe your relationship now?
I've been married for 36 years, and I've had lots of discussions with my wife in a similar way. And I'm still married and still very happy. But not to put light to that. I believe that in a nonpartisan position, it's important if you believe that something is done or that something should be undertaken, that you have the ability to defend that. By the same token, people have the ability to hold you accountable for that. So I just think that's part of doing business, and it is never a personal issue with me, and I'm sure it's not with our Premier. I think it's very helpful to sort of refocus and to consider some of the questions and some of the ways in which people do make you accountable for your actions.
Move on to Stephen Wenzel with News 95.7.
Hi, Premier. Black and Indigenous people often face discrimination in healthcare. In the United States, for example, Black women are 2 to 6 times more likely to die from complications of pregnancy than white women. You've named a 71-year-old white man as your Minister of African Nova Scotian Affairs, and your healthcare leadership team has no racialized representation. It isn't just enough to respect and listen to people. Aren't you concerned that not having someone with lived experience at the table could further perpetuate these kinds of discrimination in our healthcare systems?
Look, I'm always concerned about that, but we have lots of diversity in the leadership team across the province. And in terms of the appointment of a minister, there's a certain reality. Nova Scotians elected a caucus of PC members. We had a very diverse slate of candidates, excellent community leaders. They didn't happen to get elected this time. So I formed my cabinet from the caucus that Nova Scotians sent to me. Not that I sent, that Nova Scotians sent to the legislature, and I respect the wishes of Nova Scotians. We'll do everything we can to make sure that every voice in this province is heard, and we'll have to earn that trust. Trust is to be earned, not given, and I understand that we need to earn it, and we'll work to earn it.
We have time for one more question in the room.
Okay.
You said there's like 70,000, 75,000 Nova Scotians without a family doctor. Over the next year, where do you see that number? How do you attack it, and where do you want to see it?
Well, the number's growing. I was very open during the campaign that I personally, my family, my extended family, we lost our family doctor, and I know that in Pictou County, where I'm at, that there's more people that could be added to that list, just from what I'm hearing from the intentions of doctors. So we'll be judged on how we reduce that list. We'll be judged on how we make sure people can access health care. So we've got to acknowledge what's in front of us. We know that there's a big challenge just in retaining, in maintaining, so that number doesn't continue to grow. I'm very afraid it's going to grow in the short term from things that have already been set in place before the last 24 hours, before the campaign, even in many ways. But going forward, we want to make sure that people can access health care, and we'll be judged on that number. It's a headline number, and it's my goal. I'll hold myself to account that over the next year, certainly over the mandate, that people see changes in their ability to access health care. That's the only goal.
That's all the time we have for questions today. Thank you very much, everyone, for joining us.
Sorry, Premier Higgs just mentioned right now that he wants to see all provinces have vaccine passports so residents can travel easily, but he hasn't discussed it yet with his Atlantic counterparts. What are your thoughts on that? Are you for or against them for travel?
Look, it's the number one goal is keep Nova Scotians safe. We've done very well in this province by working with public health. Nova Scotians have done well to respect public health direction. And we're no different. We're the same. So we're going to have a meeting with Dr. Strang and Public Health to talk and make sure we understand their position on it, and we'll work with them. So and we'll work with the neighboring provinces as well, of course. But what happens in Nova Scotia will be driven by public health. So we'll have those discussions with them.
Thank you, everyone.
No decisions been made.
No.
Okay, thank you.
When will you meet with the Housing Commission to discuss housing situation?
It's on. So Minister Lohr, it's a high priority for him.
Thank you, everyone.